On the 1st of April 2011, community services were put under the national spotlight, and as a result of that transformation agenda, Bridgewater Community Healthcare NHS Trust was formed. I had the privilege of experiencing staff and services from Wigan, Halton, St Helens, Trafford, Warrington, Chester, Stockport and areas in between being together under the umbrella of the ambitious Transforming Community Services agenda. For the first time in the history of the NHS, community services were given the opportunity to form organisations that were solely focused on the delivery of care in communities. Services delivered by district nurses, health visitors, community therapists, children's community services and community dental services and many more were the only priority of the newly formed trust. A lot was riding on how we and other community providers across the country would rise to the challenge. Finally, after years of lobbying, we had a platform to demonstrate the difference community services make and indeed are still making to thousands of people's lives. Our staff are our greatest asset, and we've achieved a great deal over the past 10 years. As we've approached our 10th year as Bridgewater, it was extremely pleasing to see us achieve our best ever national staff survey response rate. Even more pleasing was an ongoing improved position on staff satisfaction as a whole. Last year saw the introduction of the National NHS People Plan and our NHS People Promise, both of which support the Trust People values and build on the key themes of the staff survey, which are important to us all in balancing our work and home lives and ensuring the best possible care for each other and the communities that we serve.
The separation of community from acute and primary care was a significant step. There were anxieties and concerns. Acute and primary care services have always had a high profile nationally. Now there was the opportunity for the people working in community services to demonstrate the difference they were making and to show how allowing clinicians to focus on community would improve the health outcomes for their patients.
Working as we do in patients' homes, community settings, health centres, clinics and rugby stadia, we are hard to define, but essential to some of the most vulnerable people in our community. Central to these developments was the need to better integrate care for those we served. Seamless and holistic care were frequently used terms.
A significant amount of time has been given and continues to be given to the development of these key relationships. Back in the noughties, however, our colleagues realised that one of the most important things they needed to do was strengthen their hand within the towns they worked, and so started the process of bringing 5 separate organisations with their own ways of doing things, their own commissioners, acute trusts and social services colleagues together. It was not without its challenges, and indeed some of these challenges remain today, but we have come a long way. It is credit to all, the frontline and our corporate staff, for the work they did back then in bringing all these diverse organisations together and laying the foundations for the future development of the organisation.
As Trust Secretary, I shudder to think about the paperwork that needed to be done to bring about such a hugely significant change. So many I's that needed to be dotted and T's crossed. It was a mammoth undertaking, and credit to those who played their part and continue to work with us today. In our time as Bridgewater, we have welcomed staff from Health and Justice Services, Bolton, Oldham and most recently Greater Manchester Dental Network. Some of these services remain an essential part of what we are, and others have moved on to other organisations. All have contributed and continue to contribute to our reputation locally, regionally and nationally.
At this time of the reorganisation, I was a non-executive director. Supporting the executives, we did what needed to be done to ensure all the systems and processes to support such a move were followed. Having done this, we realised we had a slight issue. What to call us? Considerable discussion and deliberation was undertaken. The name Bridgewater was agreed upon, and that's thanks to former non-executive director Bob Saunders, who, whilst out cycling one day, realised that the Bridgewater Canal passed through and touched upon many of the towns that we were bringing together. It is a name that has grown in stature over the years and is widely recognised as being one of the main players in the complex world of community services. Indeed, 2 years after coming into being, it was the first community trust in the country to secure Foundation Trust status. But therein lies a whole other tale. It's important at this point that I stress the mantra of the board. Services must not be adversely affected. Our patients must continue to receive high-quality, patient-focused care, and our staff must be supported.
Whilst it's important to recognise the journey we've been on and pay tribute to the work that went on behind the scenes to get us where we are today, it's also important that we celebrate the difference community has and continues to make. To thousands of people, we're the glue that holds their care together. We provide the care, support, equipment and expertise that allow people to live in their own homes. We are the men and women who get them back on their feet and back into work after major surgery. We are the ones who support them giving birth, raising their children, supporting their adolescents, advising them on childcare and immunisations, supporting their old age, and facilitating their end of life. We are hard to define, but impossible to ignore.
Much of what we do is not recognised in the media. We aren't the ones who get the screen time, the features in the newspapers, or the interviews on primetime TV. But for those of us who have the pleasure and privilege of working in community, it is unique. Whilst today is not about our response to the pandemic, it would be remiss not to mention it. The past 12 months have shone the spotlight on community services, and we have seen and heard of so many truly remarkable things that have happened because of what we have done and continue to do to support people in our communities. It's been outstanding.
So finally then, to all of my colleagues working across the Trust, thank you. We will always continue to champion the expertise of community clinicians that exists across the organisation in all of the discussions that we have with partners, and I know that you will too. It's important that we continue to demonstrate the very real difference that our organisation makes to the lives of people across our geography every single day. We can now look forward to a future where our focus will be on strengthening partnerships. Now, partnerships exist across the organisation, in every service, in every place. Every clinician enjoys partnerships with colleagues working in other sectors or in other organisations, and we need to continue to support the development and benefit of those partnerships so that people in receipt of our services don't see the join between organisations or between sectors. We need to continue to develop the relationships with primary care and social care, and to extend that into the acute sector and into mental health services. And crucially, let's start to think about how we can really build relationships with the people living in our communities, with the third sector and the voluntary sector, so that collectively the expertise that we have at our disposal can be brought to bear regardless of who anybody works for, to ensure that we continue to improve the health and well-being of the populations that we serve together. Thank you.